want to speak a little bit about the recent advances in HIV and hepatitis C particularly, because it's a really exciting time in that space, and we have the opportunity in Australia particularly to totally transform the landscape around HIV and hepatitis C and potentially transform the landscape globally. So many of you may have read about the licensing of drugs for hepatitis C, an amazing story of success when you invest in scientific discovery. Hepatitis C, an incurable disease until about 3 years ago. And now we have drugs that can cure hepatitis C in 99% of people that take it with only 8 weeks of medication. The medicines cost a lot, and Australia took the very bold move on April the 1st of funding hepatitis C drugs for everyone. It was a $1 billion investment, and no other country has actually done that at that level. And so a remarkable opportunity for Australia to potentially eliminate hepatitis C. Currently, actually, of all the people living with hepatitis C, only a fraction know they're infected, only a fraction of them actually access treatment. Once you access treatment, the success rate is incredibly high. So the challenge for hepatitis C is not really so much around the science now, it's around implementation. And that's actually no mean feat, because we have to think about the ways we deliver care or raise awareness around public health. That challenge of implementation actually has been an issue in the HIV world for many years. There's been amazing innovations there too. Of course, antiviral therapy, absolutely life-saving. People now having a normal life expectancy with HIV if they take antivirals. There are issues like point-of-care testing, on-the-spot testing for HIV. Treatment simplification, there's now injectables for antivirals so that you could literally, they're not yet licensed, still in development, but an injection once every 3 months can control HIV. But the challenge is around implementing these things that we know work. In Australia, we're doing quite well. About 88% of people living with HIV know they're infected. Of those, about 84% on treatment, and about 90% have the treatments working, meaning we can't measure the virus in blood. That's a pretty stunning achievement. It's probably world best. Not many countries have been able to achieve that. But we still have about 1,000 new infections a year, and there's been no change in the numbers of new infections for about a decade. But amazing advances in that area too. PrEP, or pre-exposure prophylaxis, that you may have read about, where people at risk of HIV, not infected with HIV, can take antiviral drugs, a bit like the pill, prevents you getting infected, and it reduces your chance of being infected by about 86%. Incredibly cost-effective intervention. And a prevention tool that could really see the end of new HIV infections. It's been just approved by the TGA here. We're awaiting approval by the PBS, meaning that it will then be funded. And if the PBS do approve it, we will be one of the first countries to actually provide PrEP nationally and for free. It's available in many other countries, but people have to pay for it. And I think this really could be transformative. I think it's really important that we can talk about the great successes in Australia, but so many other countries don't have those opportunities. If you look globally, hepatitis C, very few low-income countries have access to drugs. If you look at HIV, only about 40% of people who need treatment can access treatment. There are some amazing initiatives to bring drugs to low-income countries. Multilateral funding organisations like the Global Fund to fight AIDS, malaria and tuberculosis have done a really spectacular job of getting drugs for malaria, TB and HIV. They invest about $4 billion a year to support local programs with an estimated number of 17 million deaths averted. Australian government contributes to the Global Fund, but our contributions are decreasing. As you all know, massive cuts to Australian aid, and these are the sort of initiatives that are under threat. So I really hope that in whatever happens on July 2nd, there is reaffirmation of our continuing contributions to these global efforts. With infectious diseases, and I think Peter will emphasise this even more strongly, you can't just think about what's happening locally, we have to think globally.